and I am the vice president of the board of directors of Breast Cancer Network. I am a 5-year survivor. I'm a lifetime woman impacted by breast cancer because I have a BRCA1 positive genetic mutation, which meant I was in high risk prior to my own diagnosis, long family history. And I'm also an oncology massage therapist. So tonight I'm going to be speaking on that. But before I actually dive into my topic, I want to give you just an overview of tonight. So I have long known about the benefits of different types of integrative care. And for most of us in this room, if you've had a breast cancer diagnosis, obviously there's a lot of different treatments that get, thrown at you, right? There's things like radiation, there's chemotherapy, there's different types of surgery, there may be immunotherapies, there may be hormone suppression, or all these different things that can happen. And whether you are in the midst of it or living in the aftermath, we go through a lot and it can be really hard. And I think Western medicine, allopathic medicine, does an amazing job with their specialties of knowing what they need to do to take care of us from the standpoint of trying to eradicate cancer. Sometimes what gets lost in the shuffle is the fact that we are whole beings who have mental, emotional, and other physical needs beyond just what's happening in that moment. And so what I'm really excited about with tonight's topic is that we're here to talk about integrative therapies that can support you at every phase of a breast cancer diagnosis or experience and support you as a human being despite it all, right? And so I think that's something that becomes really important to remember, whether we're in it or whether we're kind of, hopefully, if we have the opportunity to be on the other side of it, that, or if we're living with metastatic disease, for those in the stage 4 community, that it's really important to take care of ourselves and to remember that we are more than a cancer diagnosis or experience. So tonight, I'm really, really honored to have a couple of other practitioners with me in the Western New York integrative community that I have known and getting to know, but have full faith, trust, and respect in and for. So tonight, we're gonna, after I talk about oncology massage therapy, I'm going to have Toni Haugen come up. She is a doctor of Asian osteopathic medicine, which is a very cool title and very sums up the fact that she does a lot within her practice. She's probably going to touch mostly on acupuncture tonight, but I'm hoping she'll give us a sense of all of the ways that the type of work she does can serve our community. And then Melanie Rimkus, who is a reiki practitioner. Some of you might know Melanie because she is involved with the Breast Cancer Network, and she actually does hold weekly reiki classes with our members. And so I think, these are all going to be great topics. And I'm going to go ahead and kick it off. So everybody has basically what I'm holding here. It's a little handout that I made about oncology massage. If you've already read it, then basically I don't need to talk. So if you want me to sit down, no, I'm gonna keep it free form and I'm gonna try and watch my time. So basically I'd like to see a show of hands. Who here has had a massage before? Any kind of massage? Way to go, people! That's amazing. I meet a lot of people who've never had a massage before when they come to me, and I love seeing so many hands. Does everyone here like massage who's had one? Yeah, give some big hands, some smiles, and not anyone ever here had a bad massage.
Yep.
It's okay to say yeah. Okay, it happens. Unfortunately, it happens, right? So sometimes with massage, one of the things that we hear is, maybe you had a deep tissue massage and it was painful, right? It made you sore afterwards, or it was just more than you needed. Some people are kind of uncomfortable with undressing, or, maybe that kind of, some people just aren't comfortable with touch. Some people think massage is something that you save for a spa or a cruise on your, something on your birthday, right? It's a special occasion. And it's something that often is not talked about as a healthcare modality. And I'm proud to say that massage actually is a healthcare modality, and it is becoming more and more integrated into all types of healthcare. but it's particularly important and useful in oncology care. And so basically what I want to share a bit tonight about is what oncology massage is, what makes something an oncology massage, and how it's relevant. I look at self-care through the lens of, we want it to be safe, effective, and relevant to our needs. And for most of us in that room, that means someone who's living with either a breast cancer diagnosis or a history of breast cancer. So oncology massage is basically taking traditional massage techniques. So we use things like, we call it effleurage, those nice long soothing strokes, you know, feel really good, easy. Sometimes we, do kneading, which kind of might be more what you think of when someone's giving you a back rub or your shoulders. Tapotement is a technique that, like, that chopping, that kind of classic, what you think of someone going up and down your back. Some deep tissue things like glides or using a little more pressure. So oncology massage takes all of these traditional foundations of massage therapy and modifies and adapts them to make them safe, effective, and relevant to someone living with a cancer experience. And the reason that we make those modifications is because, as you know, cancer changes us, right? And a lot of the time, it's not really even the cancer itself, it's the cancer treatments. It's what we go through to get rid of the cancer. We have surgeries that change our bodies. We have lymph node biopsies and dissections that change the structure of our lymphatic system and create risk of lymphedema. We go through radiation, which affects the tissue and may affect other parts of our body. We go through chemotherapy, which changes our count level, our blood counts and our energy levels, creates neuropathy. Like, there's so many things. And while some of these, if we are lucky, if we're able to have an end to active treatment, some of these things fade with time, right? Some of these things kind of rebound and it gets better. Other things stay with us. The effects of surgery, maybe they get better, but they don't really change. A risk of lymphedema is a lifetime risk. It doesn't get less as time goes on. And so that's why having massage at this point, if you're living with a cancer history or have a current diagnosis and active treatment, that's why it's important to work with someone who's trained. Because someone who's trained in oncology massage, actually, it's not just about knowing how to massage, it's about understanding cancer and cancer treatments and the impacts to a person who's been through them, so that we can use critical thinking skills and modify the work we do to work with you safely. So what does that look like? What do these modifications look like? A safe massage therapy care plan generally revolves around side effects, both short and long term, of chemo, radiation, and surgery. These are the major interventions for most cancers and for breast cancer. And so, there's multiple categories and multiple changes that can be made, but typically they might look like session length. If someone's in active treatment for, say, they're in the middle of chemotherapy, they may not be up for an hour of touch, even gentle, soft, compassionate touch, right? So it might be that we do shorter sessions. Pressure is a big one. When your body is working so hard, I like to remind people that even though we don't always think about it, our body is working for us all the time, even when we have a cancer, even if we have a cancer, like a tumor or a disease process happening, our body is still actually trying to correct that disease process and work in our favor. And so things like pressure can actually overburden your system. So we modify pressure. We use less. We pay attention to what part of the body we're using more or less pressure in. Someone who is in active chemo, again, might need a really gentle, light touch massage because they're not feeling great. Their energy levels are low, they're nauseous, whereas someone who happens to have a breast cancer history, but is in, pretty much back to kind of what we call normal activities of daily living, has good energy, is active. For the most part, we can work with pressure that is going to feel more familiar and normal. Position, we might, I have to make modifications all the time. I actually had a massage this morning. I started my day with a 9 a.m. massage on a Tuesday, And one of the best things that I could ever recommend, by the way, if you have a busy week, do it at the beginning of the busy week. Don't wait till after the busy week. Start out that way. But I still have trouble laying face down. I'm 5 years out, but I had a double mastectomy with implant reconstruction, and they just don't squish the same way the original ones did. So like I have to ask for, you know, a pillow or a blanket. And I do that a lot with my clients. So we can have you lay face up the whole time. We can have you lay on your side. We can adjust for a port or a medical device. And then other areas of specific compromise or concern, like skin and bone fragility, you know, risk of lymphedema or diagnosis of lymphedema. Blood clots can be a concern when you're actually, when you actually have active cancer in you or you're going through treatment. You know, various low blood cell counts, medications. There's a lot of things that can affect our bodies. And so that's kind of where we make those adaptations. So what are some of the benefits of oncology massage? Obviously, cancer and cancer treatment affects every person differently, but some of the main benefits are that we can work with scar tissue release and the associated comfort that scar tissue release creates. So surgical scars, radiation, deep radiation scar tissue, all of that can actually improve with time. And I'm happy to tell you that there really isn't a time limit on that. Yes, it's always good. The sooner we can kind of start to work with the scar tissue after surgery or radiation, usually it's a little bit easier, but I've worked with people decades out, and it's slow work, it's steady work, but we can still affect change. So just because something is the way it is now doesn't mean it has to be that way forever. We can help with increased range of motion following surgical procedures. We can reduce pain perception and fatigue. That's true, like especially during active treatment, like radiation and chemo. We know studies show that it can reduce nausea during and after chemo. Certainly reducing anxiety and symptoms of depression, right? Just giving you some time and space in your body to actually feel good, to feel comfortable, to maybe enjoy being in your skin. CIPN, chemo-induced peripheral neuropathy, that is something that there's a protocol that actually oncology massage can help with to reduce that. And again, even years out. We can help you to prepare for and recover from increasing activities. So as you're trying to kind of get back into life, you know, whatever life looks like on this side of things, helping you to feel ready, you know, feel loose, feel good in your body to start moving forward with that. And one of the most amazing side effects, I don't want to say a side effect, but one of the most amazing unexpected benefits that I found in this work is that it creates a deeper mind-body connection, and it can rebuild a sense of improved body image despite permanent physical changes. I've seen that with my breast cancer clients, that women who wouldn't look at their bodies, like I have women who wouldn't look at their breasts in the mirror for 2 years, and finally, you know, started coming for massage and began being comfortable in their own skin again, or began comfortable touching themselves, or exposing their body to a partner, you know. When I got into this work, my dear friend had been diagnosed with ALS. He was the first person I ever worked with a life-limiting illness. And, you know, he told me that even though we knew the work we did together, even though it wasn't cancer, we used a lot of the same kind of modifications and adaptations. And we knew we would never change his outcome. We knew that he had a terminal disease, and we were not going to change that or even slow it down. But he told me that the time that we spent together was the most comfortable he was during his whole disease process, that he tried meditation, he tried prayer, he tried all these other things. And that, you know, the hour of massage that I would come and sit with him and give him was truly when he felt the most at peace. And to the point where he asked me to work with him up to the day before he died. So there's the physical benefits, and then there's these emotional and mental ones as well. Who can provide an oncology massage? You know, I mentioned when I introduced our other two practitioners tonight that there are people I trust and admire and respect, and it is something, it does matter. It matters who you see. And we're talking about all of this stuff with, you know, understanding cancer treatment, making modifications to massage. it's not just about using lighter pressure. It's not just about, you know, maybe not avoiding a certain area. It really is about critical thinking skills. And there is specific training that is required to consider yourself someone who can work with anyone with a cancer diagnosis safely and effectively. So, you know, you want to find someone, typically it's going to be a licensed massage therapist, and you want to find someone who has that training. I'm not going to go into a ton of details, but I did provide information on this handout on how to find someone, like what they should know, what they should be able to ask you. You know, going to a spa and saying, well, I have cancer, or I had cancer, and they do a little 5-minute intake and go, okay, great, you know, that should be fine. It's, you know, I don't like to deter people from pursuing massage no matter what, but you have to recognize that there are things that could be potentially problematic. Risk of lymphedema being one of the biggest, because there pressure and things like that do affect, can cause a lymphedema flare up. So going to someone who doesn't understand how to work with a body with a compromised lymphatic system could be a problem. So I always do recommend that you try to find someone who is properly trained. You know, a doctor's note doesn't, like if they just say, oh, get me a doctor's note, like that doesn't cut it. You want to work with someone that you know has the appropriate training and education. One thing that I have on here is manual lymphatic drainage therapy. Is lymphatic massage the same as oncology massage? And the answer is no. They are two very different things. Manual lymphatic drainage therapy is actually its own modality. It is technically not considered a massage modality. You will find massage therapists who practice lymphatic drainage, and they sometimes call it lymphatic massage, but technically manual lymphatic drainage is a separate type of body work. It can be used by occupational therapists, physical therapists, certified lymphatic therapists. It can be used and is definitely beneficial to people living with a cancer history. It can also be used for general health and wellness purposes and to treat other conditions, including non-cancer related lymphedema. But they do go well together. So that's something to consider as well. And then I did just at the end here notate that there is something called the Society for Oncology Massage. I put their website in. They have a preferred practitioner directory. Unfortunately, there are not that many of us in the Western New York area who are practicing. It is one of my personal missions to change that. So I'm hoping that we will see some more oncology trained massage therapists locally soon. But you can always, if you are looking for someone, you can always go to s4om.org and use their directory. You can always contact me with questions. I do have a practice exclusively downtown, exclusively dedicated to working with people impacted by breast cancer. So yeah, I think I covered everything. I hope that gave you a pretty good understanding of it, and I hope that if it's something you haven't tried yet, and even if massage is never high on your list, I'd love the opportunity to introduce you to what a good massage can feel like and how it can really change the way you feel in your skin. So, and how it can help you feel better despite all this cancer stuff. Oh, that's the last thing. A trained oncology massage therapist, you do not have, it's not always about cancer. It's about giving you what you need for that session. So I have clients who come to me, and yes, sometimes they come because they're having tightness in their chest after surgery, or they're having issues with radiation or scar tissue or lymphedema. I also have people who come to me who are very stressed out. They have kids at home. They've got busy jobs. They're traveling. Their knees bothering them. They've got that hip pain flaring up again. And it is absolutely possible to take all those same modifications and adaptations and make you feel like a whole person and give you a massage that's going to be all about you and not just about the cancer history. So I'll close with that. Toni, why don't I have you come on up? And
I want to clap. Am I? Okay.
Toni.
I have my hand up. No, I wish that I would have.
No,
that was really good. There is a reason why Amy and I have kept in touch now for probably close to 7 or 8 years, a really long time. Amy is one of my most respected referrals. So there might be some doubling up on some of the things she just said. And I feel like that's okay because they're messages that are worth being driven home. So we'll wait and see how much I get into, but I thought that was really wonderful. Let me see, because I'm chatting. So I'll take a look at the clock and I'll gauge where I'm going to go with this. My name is Toni Haugen. As Amy mentioned, I am a DAOM. When folks come to my office, they usually just call me Toni. The reason why it's important sometimes to say that I have this DAOM, because being an acupuncturist in Western New York, where there isn't a cultural standard for what this sort of medicine means or how it can help us, one of the most common questions I get asked is, that's amazing that you're an acupuncturist. Did you go to school for that? And I'm like, I promise you, I went to school. I went to school for almost a decade. So we do a master's program, and then we also do a full clinical practice for almost 4 years in addition to that, which puts us into this DAOM category. And I am recently finishing a PhD program in canonical Chinese medicine. And that is in the hopes that I can get more into research. As my years as a clinician go on, it is increasingly obvious that what we need are, yes, more clinicians, but we also need far more accessible research being done on how and why acupuncture can be used culturally. I think sometimes, you know, when you're looking at something that is a medicine that has a really social and historical place, and then you kind of plop it down somewhere else, sometimes it's hard for us to understand how and why that sort of medicine will work for us. People also want to know, what is Chinese medicine and what can it help me with? So Chinese medicine, it is not separate from Western medicine. It is not the anti-Western medicine. It is simply a different toolbox. We are all talking about the same things. We all have the same goals. Those goals, from my end, from my toolbox, when treating folks that are either going through a diagnosis or are in recovery, are mainly to do symptom work and palliative care. My job is to support the oncologist and your oncology team in what they have planned out for you and what you have decided works best for your life. So no one is ever going to walk into my office and I'm never going to say to them, I do not think you should be doing A, B, C, or D. I am, however, always happy to say I am part of your team. It is my job to be in touch with your oncologist. It is my job to be in touch with the other people on your team and make sure that everything we're doing is appropriate. And if we try to add or subtract anything, not chemo, not radiation, not immunotherapy, but basically lifestyle things, potentially supplements, to make sure that that works for you. So that's my goal. The palliative care and symptom-based care that I do is a lot of the same stuff that Amy ended up talking about. It is peripheral neuropathy, it is exhaustion, it is nausea, it is anything you come in with that is taking joy from your life. This is quality of life treatment. Because at the end of our days, there is one thing that is missing from our cultural medical system, not Western medicine, Eastern medicine, but culturally, and that is helping people find joy and access during diagnosis, whether that's ALS, cancer, Parkinson's, MS, you name it. My job is to make sure that you have access to the things in your life that bring you joy. Can you lift your grandchildren? Can we help restore function if maybe you have had surgery and there's lack of range of motion in a body part or having trouble moving a shoulder? If lymphedema is keeping you from using your legs and walking, so on and so forth. So I won't go into all of the things I treat because in addition to being supportive to an oncology team, I run a general practice. We run a full medical clinic. It is like any medical clinic you would walk into, although our music is better and our staff is lovely. Those are the big differences. Our art's better too. Yeah. But besides that, all the same things are going to happen. You're going to call up, you're going to make your appointment, you're going to come in, we're going to do a full health history. We're going to do a full diagnostic workup, which I'll talk about in a second, because people are often curious about that. And then we're going to get to it. We're going to get to treatment. We're going to set up a treatment plan. We're going to have the markers of what we hope to see in a couple of weeks. We're going to come back to that and say, are you better or are you not better? And if you're not better, of course, again, these are quality of life things, these are functional medicine things, then we're going to reassess what we're doing. So, you know, I think sometimes folks walk into my office and they say, you know, I didn't come for so long because I felt so nervous about what this process was going to be like. And I feel like it is my job to take stigma away and also give people more access to care. I actually don't care if that's me. Do I love people coming into my office? Yes. But what's more important to me, the reason why I started doing this type of work was to connect people to resources. Quick sidebar, my job before this is that I was a clinical counselor. I was a social worker for years. So my passion, yes, is treating people in the here and now. It's also connecting them to resources. I will tell everyone in this room, I'm a pain in the butt. If anyone ever comes to see me for treatment, there is homework, there is follow-up. There are things that I will expect you to do. Maybe that requires 30 seconds a day. I know we don't have 15 minutes a day sometimes. I don't have 15 minutes a day. My car rolled into the middle of the parking lot. I'm a much better acupuncturist than I am a driver. I don't know what you would call it. Like, sometimes we're scrambling for our lives. And it's my job to get you to participate in your care in a way that is accessible and works for your life. So forget that car thing happened, by the way. That'll be our little secret. We're not going to tell Bill Campanelli. So sorry, what was I on about? Oh, that's a clinical social worker. So one of the things I feel passionately about is not just assigning you this 30 seconds of homework, which can look anything like, you know, I'm going to teach you how to stand properly so that the scar tissue you have post-surgery cannot be tugged on by the weight of your shoulders rolling forward. Or maybe your homework is to retrain the way that you're breathing, because when we are in fight or flight, we only use the front 30% of our lungs, and then we start to breathe shallowly, and then the rest of our bodies start to feel tight, and then the panic just sort of continues and carries on and so forth. So little things like this, anything from posture to breath work to food recommendations, you name it, we do it. The most important thing to me, besides treating your chief complaint, we're going to take that as a given. Your chief complaint is always what is at the forefront of my mind. It's not my job to tell you what you're there for, right? You're already in survival mode. You get to tell me what hurts socially, emotionally, physically. And it's my job to try to help you make that feel better. But what I end up doing is really working on the way that our central nervous system is processing what's going on around us. To get a diagnosis is to immediately spark our deepest fear. We encounter our mortality. And most of us are already living in a place where fight or flight is at the forefront of our minds. We survived a pandemic. We have survived trauma. We have survived grief. And then to be handed these very scary words that most of us spend our lives sort of fearing means that we have to help you feel safe in your body. Your body is not going to prioritize getting rid of nausea. Your body's not going to prioritize getting rid of pain in your shoulder and your trap. If you are afraid, you are not going to survive the day. We, as a society, have been hustled to survive. And you have layer on layer on layer. And there's just at some point, our nervous system says, I don't have space. So one of the first things I do is I say, your chief complaint is what is most important to me. But as long as it's okay with you, what I'd like to do today is start rewriting the story of how cortisol works in our body. If you've been existing in a place where your mind is running, where you feel scared, where you're not sleeping well at night, you're feeling your heart palpitate in your chest, so on and so forth, in addition to whatever you're coming in with, we are going to start getting you into a parasympathetic place so that you can rest, so that you can heal, and so that we can start making a plan where you're able to feel engaged and feel good about what you're doing in your day-to-day life. That's just a little sidebar. Also, just working with grief, identifying, saying out loud what we're grieving and how we're grieving it. And it doesn't have to be grief around a diagnosis. I think we are all in a place where we can accept that the past 3 years, whether we've had to grieve time or people or our own experience, I think that grief is an underrepresented emotion. I don't believe in a hierarchy of emotion. I don't believe we're supposed to be happy or joyful or optimistic all the time. I think we're allowed to feel grief. I think we're allowed to feel rage. I think we're allowed to feel fear. And one of the things that we do in our office, and some people don't want this, and that's fine, but working with the body, you end up dealing with this inevitably, whether you verbalize it or not. One of the things that I really like to do is create space for that, if that's what people are looking for. So there's a physical side, there's an emotional side, and then there's a social side, which ends up being your homework. The social side is how to engage the rest of our lives with the ways that we are improving our health and our healing in the ways that we're feeling. My office is not just me. My office has another doctor. Her name is Dr. Nicole Andres. She is lovely and wonderful, just in case anyone ever calls her. You don't have to just ask for me. We have a Reiki practitioner. We love Reiki in our office. We have a massage therapist, but not an oncology massage therapist. And I really love what Amy said. I think when you are going through something specific, look for your specific people and find the best people. Like, you deserve the best people. So call Amy, don't call her officers. I think that's just fine. And the other question I like, the other most common question I get is, does it hurt? When people have been through procedure after procedure, appointment after appointment, the last thing they want to do is come in and be in a situation where they have to be in pain. And I think that's really, really fair. So I'm going to tell you guys how it does feel to receive acupuncture. And that is, this is the spiel I give everyone. I say, this is not painful, but it's not sensationless. This is about communication. I want to hear from you. I expect to hear from you. This is not necessarily going to be passive. We're in a full conversation. Needle goes in, slight pinch or nothing at all. Once it's in, there's going to be a moment where you feel a little bit of pressure, a little bit of warmth. Some people feel a little bit of an ache. That's all safe. But safe is relative. So I expect you to tell me, does this make you feel frightened? Does this make you uncomfortable? So on and so forth. Once the needles are in, you just kind of lie. You rest. Some people do a meditation. Some people listen to music. Some people are so thankful to have peace and quiet and room to themselves for a few minutes, but that's all that they do. Time of treatment varies for everyone. If you're a person that is going to chemo once a week and you're already feeling exhausted, although acupuncture seems passive, it is not passive. We're asking your peripheral nervous system, we're asking your fascia and muscles, we're asking your circulatory system to all do a lot of work. So your treatment could be 5 minutes. By treatment, I mean the time that you lay on the table, or your treatment could be close to 40 minutes. This is personal preference, timing, and also what you've got going on. So that is usually the structure of a treatment. The length of treatment, i.e. how many times you come in, depends on the individual. What are you working on? What would you like to see happen? And sort of, how quickly would you like to see that happen? We tell every patient initially, we'd like to see you at least 3 times. Has that ever been different? Have we ever seen someone once? Of course, if someone says I want to come 1 time, they're welcome to do that. But the one thing I really like to say about acupuncture is, despite what you've been told, this is not magic. This is a process like everything else. And actually the acupuncture miracle story is one of my least favorite stories because yes, it happens. People come in, they say, I've had pain in my shoulder for 35 years. I was treated once and it went away. That's not how life works. We all know that. It's all about process. I tell people, think of this the way you would think about going to the gym. You can go to the gym once and you can lift a couple barbells, but you're not going to walk out swole. You got to show up every week. You got to put in the time. But we tell folks, you come in for 2 to 3 in a row. We set a treatment plan long-term if your problem isn't gone, but that usually looks like a very spread out treatment plan where you will get a lot of external support from our office, meaning the homework that you get will follow up on that weekly in the time that you aren't there. Some of our patients, generally not during active treatment, but in recovery, there are lots of folks that will get herbs from our office. I tell people, I actually really dislike the way the herbs are talked about in here now. Herbs are being used in a really allopathic way where people claim that they can cure everything. They can't. Herbs don't cure everything, and herbs are actually like a really particular, really sophisticated science. So I tell people to think of their herbs almost like a custom supplement made just for them that they will almost never take long term. I do have folks that say, I feel amazing with such and such thing. Can you make me something that I take monthly, every like a couple of days a week? And I'll say, great, I can design that for you. You're cold in the winter, I can make you something that'll warm you up. It's cinnamon and ginger. You can buy it yourself. But for the most part, that's just like, I know I just sort of slid that in there, but we do have a full herbal pharmacy. My time is up. I could keep talking.
If you have more to say, go to like 10 till, like 10 after. Well, a few more minutes.
10 after?
We'll make it work.
Okay.
We'll make it all work.
Thank you.
And Q&A and
Melanie, 2 minutes. You got 2 minutes. Tell you're up. Now that I said that, I'm like, actually, that was fine.
Will you real quick just define the word palliative for everyone? Just because it's a personal sticking point of mine, and I want to make sure that we're all on the same page with your language, with the language.
Okay, beautiful. The way that I'm using the word palliative care actually can mean 2 things. I'm using it in one very particular way here, and that is my goal is to lessen your symptoms so that you are able to operate within your life. I'm not here to make you guarantees that I will take away something that, like if you have a huge amount of scar tissue, can we lessen that? Can we create range of motion? Can we lessen the pain that you have with that? Absolutely. But I'm very cautious about talking in absolutes or making promises to people. The other way that I use palliative care is I do end of life care in my practice. I do end of life care both in a couple of institutions, but mainly in people's homes. And palliative care in a very different way can be used to mean that. Tomorrow I will go and do a home visit in Corfu for someone that is in really late stage MS. But those are just sort of two different ways of using the word. And I don't know if you use
that's perfect. Just that I just wanted to ensure that palliative care is often understood or used with end of life care, but they are in no way synonymous. So when you hear palliative care, the first thing you should think when you hear palliative care is pain management, quality of life, comfort, nothing to do with end of life, just so that it comes into play at end of life, but it is not, they are not one of the same. And I just think that's, I feel like that words have gotten very convoluted in a lot of the way we are in the language that we use. And I feel like we're those of us who are trying to clarify.
That's a good point. So, you know, that's it in a nutshell. I've studied 5,000 years of history in medicine. I would love to tell you more about it. Section. I think if I was going to say one thing to wrap it up is that, you know, when folks start working in my office, this includes my office staff, I always tell people, like, the most important thing is that when people walk through those doors, that you are kind to them and you create a place for them. And I know that the medicine I practice in this place and time is non-traditional, but I do believe the first thing we do to treat people going through any serious healthcare diagnosis, whether that is physical, whether that is mental, whatever it is to make people feel like they are able to ask questions, that they won't be asked to advocate for themselves, but if they do, it will always be welcome, and that we are here to listen. Because when any sort of healthcare practitioner does those things, people receive good healthcare.
All right, Melanie, bring it home. Big shoes, big shoes. No, that'd be great. Right.
Hi, I'm Melanie. I've been volunteering here since a couple of years now. Thursday mornings, 10 a.m. on Zoom right now, hopefully back in person. And what I do is Reiki. And I've been doing Reiki, practicing Reiki as a Reiki practitioner for 10 years come this February. I've fallen in love with Reiki. So my goal tonight is to hope you guys leave here being so interested. You're going to Google it. You're going to want to love it. You're going to want to find it. You're going to want to use it. And you don't even have to find anybody to be able to use it. So let me just show you how to empower yourself. All right, so we're going to talk. I'll give you a briefing about Reiki in general, and then what an experience like going to see a Reiki practitioner might be like, and then we'll get into the fun stuff. I'm going to force you guys to pay attention and be proactively active with me. All right, so what is Reiki? Reiki is a Japanese holistic energy healing modality. It started in the late 1800s, and then about 1922, a gentleman from Japan named Maikao Usui created the Reiki style that is here in the United States today. It's 100 years. You guys asked me to come this 100 years, so let's celebrate 100 years of Reiki. Exciting, but okay, still, what is Reiki? So holistic mind, body, and soul. I think Amy touched on that a little bit. It is important that we embrace all aspects of self. We are not just a physical body. We are an emotion. And we have, for what most people believe, is soul. So to me, I do believe there's three parts. And in the Japanese thought process, there's a word kokoro, which means heart and body. Heart and body, good. To have healthy kokoro. So Reiki is the word in Japanese, which Japanese language is most kanjis, right? Chinese, like they have those, the symbols look a little weird and unfamiliar because it's not an English alphabet. It's just the kanji, and Reiki means universal life force energy. That's what it means in English. But it still gets a little bit scary when you start talking about like life force. I mean, I read Star Wars, like what's life? Once you understand it's not scary. It's like the monsters under the bed. You don't know what they are until you watch Monsters, Inc. And you're just like, oh, the whole time I was scared as a child. Had they had that movie back when I was a kid, I wouldn't have been scared. So I'm going to break down what life force energy is, because truthfully, it's not that scary. So Reiki isn't anything supernatural, fortunately. It's not anything magical either. It's something that is in all of us that we have. And you really don't need to go to see anybody to do anything with it. Okay? So We're gonna break this down a little. So I do have these cards because some of it's science and Google. And we know everything on Google is true, right? We know this. But because I don't know everything and only Google does, fact checked by my husband, who's an engineer, I'm gonna talk about some things. But most of the people know this. And we do have some doctors. Okay, so the human body is composed of matter and energy. Pretty simple. I fact checked it. It's good. Atoms are the basic building blocks of matter. You guys kind of following a little bit? If you get confused, don't ask me. Just play along and shake that head. Okay, so we're going to talk about an atom. We're going to break it down a little bit, and I'll tell you why we're breaking it down in a second. So an atom consists of a central nucleus that is surrounded by one or more negatively charged electrons, protons, neutrons, electrons. Is she really going to talk about this the whole time? Yes. Why? Because my daughter got in the car, 10th grade she is, taking a chemistry class, so proud of herself. She said 3 things to me. Mom, did you know in an atom, it consists mostly of nothing? Because we learned that in chemistry. I had to go back and ask my husband. It's true. We'll get to that. She also said, did you know if the sun in the sky burnt up, it would take 8 minutes for us to know that it burnt up? Because it takes 8 minutes for the light to travel to us from the sun to see it. And me looking at you guys, I'm actually looking at your past. It's only milliseconds of the past you. What is all this about? How does my daughter know more than me? So I started using this as what I was going to talk to you guys about. So atoms are 99% empty space. Yet it makes up 100% of the universe. Wait, we're talking about matter? Talking about the universe? Well, if you did the math, I don't know, I'm not good at it. 1% of us is actually not empty. Where's the 99% and what can we do with it? All right, follow me. There's a whole point here. I'm going. Every human on Earth is made up of millions of atoms, which are all 99% empty space. Condensed. What are we doing with all that empty space? All right, so we're just talking about atoms, talking about matter. So let's get to energy. All right, so I'm gonna do a little more science. We're gonna get through this. Couple more minutes. I'm watching the clock. So back in 1842, so long time ago, the guy Julius, or girl, I'm not even sure anymore, Mayer, created the law of conservation of energy. It's still true to this day. Energy cannot be converted in form, or can be converted in form, but not created or destroyed. So you can't destroy energy. So even when we die, we're made of energy, we go somewhere. We're never really gone. That's exciting. I'm glad about that. So, all right, so wait a second. So mass, our body, and energy are interchangeable. Mass is a manifestation of energy. Guys, I don't know if I'm losing you. Trust me. So everything, including humans, is simply energy stored in mass particle form. Science is complicated, but we're talking about Reiki here. If you are looking at energy, table, everything can't be destroyed. All right, and mass is interchangeable. Universal life force energy, Reiki, is actually in each one of us. We are energy. And we have 99% of the room to do whatever we want in our body. In the end, I'm going to prove it to you. I'm going to prove it to you because there's 2 people, if they were in this room today, would want to have a conversation with me. I am sure of it. And if these 2 people that I'm going to talk about are intrigued, then you guys should be intrigued also. So we're going to talk about the Austrian physicist, Erwin Schrödinger. Has anybody ever heard of him before? Schrödinger's cat of the story. So what he said is, what we observe as material bodies and forces are nothing but shapes and vibrations in the structure of space. So we're a shape and we're a vibration. It's true, actually. And then essentially everything is energy. So we are energy. One more person, Albert Einstein, and then I'll get to the proof. Reality is merely an illusion, although a very persistent one. He created the theory of relativity, behavior of objects in space and time. Okay, so we talked a lot about stuff you don't really have to remember. You'll Google all the facts. Are you really made of 1% of something, 99% of nothing? We're gonna do a little test. So here I want all you guys to raise your hand if you think your thoughts can affect your physical body.
Oh,
And you guys just proved everything I said. Do you want to know why? Because you raised your hand with your thought. You raised your hand. Everybody here, please, who didn't raise their hand, right? So if you can raise your hand to answer that question, is it possible the healing response in your body can also respond to your thoughts? You just proved it could respond to you raising your hand. My husband said, well, the nervous system can affect our cells. Digging deep. So therefore, what we think we can possibly move, or do we think we can possibly move a physical part of this world? That's Reiki. That is Reiki. You don't need to see a person. Oh, I gave you a good list. We'll talk about it. Reiki is the understanding and the belief system that you just proved that with this, we can start to change this. And I'm not going to say it's easy. It's going to take work. And going to see a Reiki practitioner, I gave you guys a list, a little list of people that I know in the area. I can give you a list that's really long. It's just a small list. Okay. All different personalities, all different walks of life. But I can tell you that most, I want to promise, I'm on the top list, number one, of course. Everybody in that place and on that list will hold space for you and work with their belief, what they've seen Reiki do for people, and what Reiki can do for you. So if you go to the gym to exercise, you can stay home and exercise too. But you can maybe go better if you go with a partner. You can go to physical therapy and they can tell you what to do, and you can save the $40 a week, and you're going to do those exercises at home, aren't you guys? Right. You're not going to. You could probably maybe massage a few fingers. No, go see Amy. Right. So sometimes we need someone to hold space so that we can work on self-care with ourselves. And they can offer the assistance so that you can allow that universal life force of you raising your hand to work on the cells of your body and create something that's best known as, and I'm not saying Reiki is just this, but for you, what you can help create during a Reiki session yourself is the placebo effect. That's in every scientific study out there. It's 3 to 4% of every scientific study where people they call it magic, they don't know, fix themselves. And science doesn't understand it. So do you know what they do with the placebo effect? They throw it out. The one thing that somebody didn't need any treatment for, and they don't want to study it. And this is what they assume was a placebo effect. I'd say double it, 6-7%. That is what we're talking about with Reiki. So if you were to come on Zoom session, and what I really feel like I want to talk about with you guys, and what I really press during a Zoom session with me for Reiki, or you can come to my office, but with the Breast Cancer Network, self-healing, give gratitude to your body, tell your cells you love them, tell them that you are complete, you are perfect, you are whole. I make people put their hands on their head and thank their brain for being there for us and for the ability to process thoughts. And thank your ears for being there for you, for the ability to hear, and your eyes to see, and your mouth to taste, and your nose to smell and breathe, and the organs in your body. And give love and be that percent that's out there that we just don't understand, but Albert Einstein understands. And Erwin Schrödinger understands. And I know you understand, and you understand. And thank goodness for Western energy medicine, because right now we cannot rebuild back a leg if it is injured and falls off. We do need the doctors to help us, but we can help ourselves. So Reiki is like an additional set of an energy healing modality that works in conjunction, but never without Western energy medicine. Reiki is amazing. It is so great. So know that each one of you guys have life force energy. So tonight, if you go home and you put these hands and you just put them on your chest, you take a deep breath, breathe out all the way down in here, and you tell yourself that you are complete, you are perfect, and you are whole. Say it again until you believe it. Know that all of you gave yourself Reiki. If you want to know more about it, You want all this awesome inspiration that I have? I will send it to people, to places, and to myself, to give you guys that inspiration to see the things that I have seen people do for themselves and the healing that they have cohesively done for themselves that I got to witness. I'd love to be part of that witnessing story. I don't know how fast I did that, but
That's solid. That was amazing.
I got through the signing stuff, but it had to be there. I have the note card and someone wants to take them home. Back to the matter. We are energy. Yes. Thursday mornings, 10 a.m. guys. You can talk to me later if you want.
So much. So I don't know if anyone, what you made me think of, Melanie, and I don't know if anyone else knows this, has heard this of a study, but there was an experiment with water where, and I don't have the, the details on it, but you're nodding, Yeah. It was an experiment that scientists did with water, and they made different containers of water. And to one water, they said really, like one container of water, they said really lovely, nice things, loving words, kind words. And to the other container of water, they said mean, nasty, horrible things. And the water's molecular structure changed between the two containers based on what type of, message it received. So if that can happen with water, and we are what, like 97% water, right? So there you go. I think it's Melanie definitely proved it. I want to be mindful of our time. I do want to take a few minutes for Q&A, and then we might, I don't know if we have any other announcements before we head out, but yeah, who's got questions for any of us? Any questions for Toni, for Melanie, or myself?
I do. Where's Toni?
Okay. I'm here.
Can you work with lymphedema?
Mm-hmm.
I'm there. I'll call you.
Okay.
Okay. Thank you.
Yeah, excellent.
I was going to ask, does it increase your chances of lymphedema? Like, what is the risk with it?
That's a good, and I am curious because
People say,
as a lymphedema
What'd you say?
therapist, go ahead.
I've heard people say that it's been worse and acupuncture has not been beneficial. So I'm like,
there are certainly moments, they'll come in and we'll do a diagnosis, but I have many people that have come to see me. They've done wonderful. I don't treat 100% of anything 100% of the time, right? I'm like any doctor. There's a percentage of failure rate. There's a percentage of this might not work to the extent that you want, or it might not work for you. But at least in my practice, if there was a study on this, I would claim it was either made up or whatever. Like this is why I want to get into research. We don't have numbers on these things. No one in my practice has come in and said that they've gotten worse. There are people that have stayed the same after 3 treatments, those 2 treatments. If their condition has not changed, it's my job to say, we refer out. I don't continue to treat you, but we've had lots of success.
I guess my question was like the needles, like, supposed to get the blood pressure and don't get any blood
I don't needle
draws
into the lymphedema itself.
Okay.
So if someone was needling into the lymphedema, it could absolutely make it worse. And if someone tries to needle, this for anyone here, into your lymphedema or any other mass or bump on your skin, that is not good work. You don't needle into anything in the body that's already swollen. So we'd actually probably work more with your spine, with your legs, and with your core. So we would work with the other lymphatic tissue and probably actually not work directly in the arm.
what is your office's, what is it called?
We're Queen City Health and Wellness.
Where is it?
It's on Delaware and Mohawk. So you pretty much across from New Era Cats. Like you can see City Hall from our front door. And we've got all the normal stuff like Instagram and Facebook and all that. I do want to tell you guys that because I know that this can be so scary and, making something worse, co-infection, etc., can be such a concern. I really want to encourage you guys. We're not pushy. If you come in, wonderful. If you don't come in, also like wonderful, as long as you're on the right path. Like feel free to call and ask a question if you don't get to ask a question tonight or something hits you later. Email, you can text, you can call.
And you guys have my contact info, and you are welcome. If for some reason you don't remember or you didn't write it down, you can hit me up and I will get you to it.
I'll leave a couple of cards
as well.
So you guys can just
thank you. That was a great question, great comment, and I'm glad to know, because I've wondered. I mean, I know Roswell has someone who does, I don't know what her official title is, but she does acupuncture. She's on staff. I have clients who go for lymphedema treatment to her and have a lot of, luck with it. As a lymphedema therapist, like you said, we pay attention to things that could create an inflammatory response, risk of infection. Needles would be one of them, but as Toni said, it sounds like that isn't just like with manual lymphatic drainage. We engage other parts of the lymphatic system to help pick up what this part can't do. Sounds like it would kind of be a similar method. And thank you for that providing this information too.
Right. I'll say one quick add on that.
Yeah.
The way that we would like specifically work on is, your spine has dermatomes that come out. So there's sections of nerves that go into your limbs. So we would most commonly use the nerve roots at your spine to teach it. So that's primarily why there's not a fear of lymphedema,
right?
Because we're not actually in the lymphatic tissue.
Brilliant. Okay.
And I just have a question.
Sure.
What exactly will acupuncture do for like neuropathy? Like, does it reduce the numbness or just the pain, or like, what is your?
Both.
Okay.
But neuropathy is probably the most common thing I see in folks, and not just oncological neuropathy, but all different sorts. Because the system of acupuncture, and I'll keep this super brief, you want to think of it as the layering of the systems of the body. So we have fascia, we have of course, they're all intertwined, but there's fascia, there's the circulatory system, and there's the peripheral nervous system. The way, like the pictures that you have seen of these acupuncture channels, that is one of the ways that we are ordering those things and the way that they communicate with each other. So when we are treating something like neuropathy, the first thing we do is go through our diagnostics and anything that you have from your doctors. I always want to see an MRI report. I always want to see a blood result. I always want to see a CAT scan, like whatever you've got. You're not only expected, but encouraged to bring it into our office. So we look at causality. If you've just come out of radiation and we're afraid that the myelin sheathing on your nerves is fried, then the first thing we're going to do is start trying to restore the myelin sheathing on your peripheral nervous system so that there's not pain, so that there's not numbness. If it's because your circulatory system is too weak to get blood to the exterior parts of your body, then we're going to work on that. So numbness, pain, whatever you've got, but it is individual to the person.
Thank you.
You're welcome.
Are you finding that insurance is covering your procedures?
More and more. The first thing I tell people is call your insurance company and ask if they will provide to an out-of-network provider. I recently was at an event and walked up to the insurance lady and I was like, can you tell me which plans will cover acupuncture? And she was like, no. And I was like, but couldn't you just like tell me? And she was like, well, you can call the number on their card, and so on and so forth. So I will say this, all HSA, all FSA, a lot of out-of-network things. There is some Medicare and Medicaid where you can call and ask for a disbursement. Our office will help you in any way they can. Unfortunately, if anybody has an in how to figure out what plans will cover out-of-network care, please let me know. I'm happy to do the legwork. But some yes, some no.
And okay.
Yeah. You had mentioned about scar tissue to help with that. In conjunction, is there, because we're working on that, and if it's really bad, can I prove you guys all?
Yeah, no, absolutely. And that's what I wanted to, that's kind of why we did this tonight, because as the three of us, because there is no one answer to anything. And that's often true, that's true in, other types of oncological treatment, right? Like I mean, sometimes people get away with maybe just like, I don't say just, but with a surgery and without other things, but a lot of the time it's a combination. And that is particularly true in whole body, holistic wellness of taking care of ourselves. So a lot of the time you are going to benefit from trying multiple things or getting relief through multiple forms of work. So yeah, absolutely. I mean, there's never any, there's no conflict between, say, seeing and coming for oncology massage or scar tissue release from a massage therapy standpoint, and then also working at it through acupuncture. Same with neuropathy. We approach it in different ways. Toni's using an entirely different system in the way she treats, but I have a protocol for neuropathy that uses pressure. It's a more mechanical with the actual areas affected that can, that does relieve neuropathy. From our standpoint, it's more of a it's the theory that, that the actual medication builds up in the capillary beds and congests that. And so it's a literal like pushing of the tissue. And I mean, I've had lots of clients who have, you know, some instant relief and some ongoing relief with time. So I always say it's kind of better if you can swing it, it's better to try, you know, especially if one thing isn't getting you quite all the way to where you want to be, what else can you add in? And the same thing, you know, it is true with a lot of integrative care. Unfortunately, a lot of us are, you know, we're not able, especially for those of us who are maybe in solo practice, it's really difficult to partner with insurance companies, you know, lots of different nuances. But a lot of the time, the same thing, like for me, and I know other practitioners, an HSA, an FSA card is easily run. I have clients who, you know, whose insurance covers it. They pay out of pocket. I provide a detailed receipt and then they get it submitted and then they can get reimbursement. So there are ways to make it, you know, to make it work for you.
Yeah, I think the only thing I'd like to add is one of my favorite things is for someone to come in and say, whether it's been massage or PT or, you know, what have you. One of my favorite things to say is, would you like me to talk to your other practitioner and figure out where you started, where you came from, so that it's not just you guys having to always retell your story. It's sort of my job to help you do managed care, because I don't completely understand, but I would love to believe that I am attempting to understand how frustrating and exhausting just managing care, retelling your story, and having to constantly re-explain your condition is. So one of the first things I'll do is I'll say, do you want me to talk to them? Because I have a HIPAA release. You can sign it and I'll call them today. I'll get your records. We'll have a full conversation. So, you know, that's only to say, not only am I, can we work with other practitioners, but I believe it's like the hallmark of good practice to make sure that you are reaching out to the other practitioners and doing combined care.
I think that's the major problem in Western medicine, is that doctors don't communicate. Even if you're in the hospital, they just don't communicate. They just come and do their job and then leave. And it doesn't like mesh then, like you're just, you know, it's sad.
It's hard. It's one of the downsides to extreme specialization. You know, you get all the upsides of them really knowing what they're doing, but you also get a lot of fractionation or whatever that word would be. And you know, luckily there are some things happening even locally. We've got Rachel here, Rachel Wallmeyer, who is a patient care navigator in the breast clinic at Roswell. It is her job to kind of be the point person. So if you as a patient are, you know, struggling with some things, with side effects or with, you know, some different wellness things, you know, they actually have Rachel now to kind of be like, hey, I know Toni and I know Amy, and I'm going to give you these referrals. And I think that they can be beneficial for you, because the surgeons aren't that person and the medical oncologists aren't that person. It would be great if every practice had a match, you know, if every cancer center and practice had a much larger, you know, focus on that, but we do what we can with what we have. So I am mindful of our time because we are a little bit over. Does anyone else have any burning questions? I'm going to go out on a limb and say that you can absolutely, if something comes to you later, something you didn't feel comfortable asking, I know for me, and I feel wholly comfortable speaking for both of our other speakers tonight, that you can reach out to them and contact them with that. And I would also go, I'm going to state confidently that nothing's off the topic. Like nothing's off the table. Like I know Toni, I mean, you guys have heard me talk. There's lots of times that I've brought up things around sexual health and wellness, pelvic floor therapy. Like there's a lot of things that are affected by a cancer experience and just with life in general. And, you know, I know Toni recognizes that. I believe that, you know, Reiki and whole body self-healing is all of it. And if it's not something that falls within our particular scope of practice, we very likely know someone. Like tonight, we made a connection that one of her best friends and colleagues and trusted referrals is a pelvic floor therapist who I've recently come in, you know, contact with and started referring to. So Buffalo is a small city, and you know, if we aren't one of the people to help you directly, we might be able to send you the person who can. So you've got, it's part of what the network is in the breast cancer network.
I have a quick question. How do we get on the Zoom for the Reiki?
Yeah, that was my question too.
Right in the Breast Cancer Network under continuing education.
Go to the website.
Yep, it clicks, you can click right in.
Do you record it? So it's like I work at 10 now.
No, but I do have a recording, a self-healing recording I can send you if you reach out to me that I did with you. You can still walk through your thoughts. It's awesome. So, and what I did want to mention is, and you can kind of reach out to Rachel maybe, but there is Reiki is right now they take appointments at Roswell. You can get treatment done there for free. And I do actually have Tuesday mornings also if you guys want. You can jump in. I do that on Tuesdays. And I hope to at one point offer, if I can ever work around it, hope to offer that here. And I do hope to offer at one point a free training class for you guys to learn Reiki. So if there's enough interest, please let somebody here know so they can reach out to me. And on a Saturday, I'll come in and train you guys for free. Okay. So, all right. So there'll be interest. Yeah. All right.
Is this program been
Yeah. So tonight's, so tonight's tonight's talk was recorded on Zoom, and it will go up on our YouTube channel. We usually send out a follow-up after the event, like an email with the link. And if we haven't, we're planning to do that, I'm sure we can plan to do that, right? Is that pretty easy?
Oh, that's in a what? Send an email.
Yeah.
Yeah.
Don't we usually do send an email? Yeah, like that's easy enough. And I think our YouTube channel is linked through our website, so you can find the replay to rewatch it. You're welcome. Any final thoughts? Going once, going
My final thought is if anybody wants to take any takes home, there's places where you can take.
It's sold. All right. Thank you, everyone.
As always.
Thank you.
And you haven't yet, please come on Saturday, either morning or afternoon. It's going to be a great event. 3 hours of community and self-exploration and learning, and a chance to just take care of yourself for a little bit. As always, we'll be having our monthly speakers second Tuesday of every month. Topics will be announced as we get closer, and you can always find that on the website. Anything else?
We do classes. No, I just want to thank all of our presenters for doing a great job. It's really good to be back in person. When the pandemic first hit, we had no choice. Everything had to go on Zoom. And I was very impressed. I had nothing to do with it, so I can say I was very impressed. Last year, we had some ups and downs, met sometimes in person. But we always did everything on Zoom too. I have found just this year from last month's meeting and this one, it is definitely different when you're together, when we're together. That's how this whole organization started. And it really means a lot to us to see all of you here. It just feels different. With great presenters, but in person. So if you can keep coming, we would really appreciate it. And just thank you all. And again, if anybody wants to say for the support group, see Judy at the end of the wall there. There's our support group meeting. And anything else from anybody? Any questions? All right. Well, thank you all very much.
You need a job.